Mood disorders cause great suffering, and unfortunately, they're very, very common. So let's learn something about mood disorders. Mental disorders are diagnosed using a book called the DSM, which is in the 5th edition. So it's called the DSM-5. It's published by the American Psychiatric Association. And in this book, mood disorders are divided into two different chapters. One we can call depressive disorders or depression, or sometimes called clinical depression, or in this case, I'm going to call it unipolar, meaning one side. And this is people who have low moods and other problems, and also sometimes normal moods, but they don't have very, very high moods. For people who have very, very high moods and also sometimes have depression, that is called bipolar disorder. That's a separate category. It used to be called manic depressive illness. People who have mood disorders have many symptoms that go beyond their mood problems. They have sleep problems and eating problems and cognitive problems, sometimes even psychosis. Psychosis means out of touch with reality, so that means like having hallucinations or delusions. Depression is not the same thing as unhappiness or disappointment. Sometimes people say, oh, I broke my fingernail, I'm so depressed, or I failed a test, I'm so depressed. No, that's not depression, that's unhappiness or disappointment. Everybody suffers from unhappiness sometimes. Depression is a different brain state, and it has many symptoms other than low mood. There are many questionnaires or inventories that measure depression, such as the Beck Depression Inventory, a very, very familiar, common one. And they ask questions like this: I feel like I'm worthless. I don't enjoy things. It's hard for me to concentrate and make decisions. People won't care if I'm not around. I don't enjoy going out like I used to. I'm not motivated. I prefer to be alone. My appetite has changed. My sleep habits have changed. I feel fatigued and don't have energy. So you can see that mood disorders involve many symptoms besides just a low mood. In fact, about 10% of people with depression don't report having a low mood. And interestingly, when they take medications or get treatment, they often say, wow, I didn't realize that I had a low mood. I didn't realize I was depressed. One of the important things to understand about mood disorders is they go in cycles. This is an episodic kind of illness which sort of comes and goes, although, of course, some people have problems, lifelong problems, sometimes what we call treatment-resistant depression. But the idea is that mood disorders typically follow cycles, and these cycles are often related to brain chemicals like serotonin. So when serotonin levels are very, very high, a person feels manic, and when they're very low, they feel depressed. In the DSM, the official book for diagnosing mental disorders, if we look up depressive disorders, what I'm calling unipolar depression, we find 9 symptoms listed: a low mood, a loss of interest in things, eating problems, sleep problems, movement problems, fatigue, inability to make decisions, feeling worthless or guilty, and suicidal thoughts or suicide attempts. If a person has 5 or more of these symptoms for 2 weeks or more, the diagnosis is major depression. If there are 2 or more symptoms that go on for a long time, sort of lifelong, this is called persistent depressive disorder. And if you have both, a lot of symptoms for a long time, that is called double depression. A second chapter in the DSM deals with bipolar disorder, what used to be called manic depressive illness, because in this case, a person has sometimes depression, but at other times they have periods of what are called mania. A manic episode is when a person feels very, very euphoric, very high, very, very active, can't sleep. So what happens with bipolar disorder is people have these periods of mania, which last about a week, and then they are followed by severe depression, which can go on for months. And bipolar disorders are divided into 3 categories. Bipolar 1 is the most severe and sometimes involves psychosis, hallucinations and delusions. And then bipolar 2 is a little less severe. And then the more mild one that sort of lasts a long time is called cyclothymia. Here's a funny cartoon about it. The doctor says it looks like bipolar disorder. Yeah, it's a penguin which comes from the South Pole, but has a Santa Claus suit on from the North Pole. So it's bipolar. Haha, funny. So what is mania all about? What does a manic episode feel like? Okay, in a high mood, a person feels almost too good for days, maybe a week. They go with less sleep without feeling tired. They have lots of ideas. Their brain feels sped up, just speeding. They're very talkative. They take on tons of projects. They unfortunately have risky, irresponsible behavior. They might feel smarter and more attractive than usual, and sometimes they get in trouble. This little pie chart shows a typical situation for people with bipolar disorder. It ends up being they are depressed for almost a third of their lives. So you see that depression is much more common in bipolar disorder than mania. Mania takes so much energy, you just can't do it for very long. But also notice in this pie chart, no symptoms about half the time. So people with bipolar disorder go through these cycles of manic episode followed by depression and then followed by normality, and then manic and then depressed and then normal. And a person could have 3 or 4 or 5 or more of these cycles in a year. That is called rapid cycling, by the way, or these could be stretched out over long periods of time. Perhaps you're wondering who this happens to. Okay, let's look at some statistics. For unipolar depression, what is called clinical depression or severe depression or major depressive disorder, it's hard to give a statistic because it varies so much by different age groups. The incidence, the prevalence of this disorder is about 8% to 17%. It roughly increases with age. So it's more common in older age. In fact, middle-aged women have the highest rate of depression. And it also tends to increase with each new generation. So each new generation group of cohorts that comes along has a higher rate of depression. So in my age group, older, middle-aged people, we are at about 8% depression. But when we were younger, only about 3 or 4% of us had depression. For young people today, the rate is about 17%. And if that statistic continues, when they are older, about 25 to 30% of them will be depressed. Now, bipolar disorder has a much lower rate. It's 1 or 2%, and it's always been about 1 or 2%. One of the big differences between these two mood disorders is the gender difference. So unipolar depression, there are many more women, 2 or 3 times more women have unipolar depression than men. There are many reasons for that. Some of them are biological reasons that have to do with hormones and brain functioning, but also other societal problems and social problems and even the way people are raised and brought up. A bipolar disorder tends to be about the same in men and women, maybe slightly more females, but it's about the same. So these are different kinds of disorders. Unipolar depression often has family causes such as abuse or alcoholism in the family, whereas bipolar disorder follows closer to genetics. And in fact, bipolar disorder often is seen in a family where there's also schizophrenia. So there are many, many genes that influence these disorders, and the genes for schizophrenia tend to overlap with the genes for bipolar disorder. So we see these running together sometimes. There are many different things that can cause mood disorders. Genetics, of course, is one of the important variables, but also prenatal factors like infections or toxins or birth problems. Also, hormonal imbalances. For example, the thyroid gland is, when it's acting up, it can cause depression. Abuse and trauma, of course, isn't that obvious? Any kind of loss, when a person suffers a loss, that often leads to depression. Any conflict or stress, any kind of major life changes, even changes for the good, can be stressful for people. A serious illness, of course. Substance abuse is interesting because it's a two-way street. Substance abuse can lead to depression, but depression can lead to substance abuse. And then smartphone or social media use also has been shown to be linked with mood disorders, especially depression and suicidal thoughts. Maybe the most common theory in psychiatry about mood disorders is called the monoamine hypothesis. Monoamine is a word that refers to certain brain chemicals like serotonin. And the theory is that these brain chemicals are somehow have gotten out of balance because of trauma or abuse or some kind of biological event or genetics. And in fact, when people take antidepressants, this tends to increase serotonin activity, which some people think is why antidepressants sometimes help people. So this is the most common idea is that brain chemistry is related to mood disorders. Another idea about mood disorders is called the neurogenesis hypothesis. Neurogenesis means the creation of new brain cells, of neurons in the brain. And this happens in several parts of the brain, but especially in an area called the hippocampus. And the hippocampus is important for learning and memory. And it turns out that the hippocampus does make new cells every day that help us learn and remember. And when you're depressed or have stress, this neurogenesis process tends to stop or decrease. And that's why people who are having anxiety or stress or depression have trouble with learning and memory because their hippocampus is just not functioning well and not making new cells. And also, it's been discovered that when you take antidepressant drugs, this tends to help neurogenesis increase, and so maybe that's why antidepressant drugs sometimes help people with depression. Another interesting theory from psychology about mood disorders. This chart shows a study of 8th, 10th, and 12th graders, asking them if they feel like they're left out of things or if they feel lonely. And notice how the chart really increased a lot after 2007 when people started getting iPhones and started getting onto social media and staring at screens for hours and hours every day. So a lot of scientists think that maybe screens are bad for you, and we have quite a few studies that show this is correct. Here's a fairly recent study of over 500,000 8th, 9th, 10th, 11th, and 12th graders found that depression increased 33% between 2010 and 2015, and the suicide rate for girls increased 65%. So we think this is another bit of data that shows that maybe the social media, screen time, smartphone is harming people. We have a good deal of research on screen time, and especially have discovered that children are harmed by this very much. Huge increases in problems with language and behavior and cognition and socializing. Uh, this has become a major public health problem. And in fact, children under 3 should not watch screens at all, and other children should be limited very much in their screen time. Of course, as you know, smartphone use is just a huge problem in the modern world. People sleep with their phone, they eat with it, they play with it, they talk to it. It's almost like they have a relationship with their phone. And there's even a new word that's been created called phubbing, phone plus snubbing, phubbing. And this is linked to relationship problems. Children who are phubbed by their parents have higher rates of depression. So when we're talking to someone, we should not look away at our phone. Don't phub other people. One type of mood disorder is called seasonal affective disorder, or SAD, and this occurs when there is a very low sunlight, like in the winter time, in some people. So some people's brains are very, very sensitive to the amount of sunlight. It turns out that sunlight helps to set our body clocks, what is called circadian rhythm. We have a little region in our brain called the suprachiasmatic nuclei that are located in the hypothalamus, and they help to these areas help to adjust your body rhythm, your body clock. And so when we get up in the morning, the sunlight goes in your eyes and sets your clock. When there's low amount of sunlight, like in the wintertime, some people are disrupted by this and end up with mood disorders. If you have a mild case, it's called the winter blues. One thing that some people with seasonal affective disorder have found to help them is called light therapy or phototherapy, in which a person will sit in front of a light that has certain wavelengths that will stimulate these parts of the brain that set the body rhythms. And this seems to help some people who have seasonal affective disorder. Some depressed people do not respond well to treatments. This is called treatment-resistant depression. Dr. Helen Mayberg at Emory University has a team of people that implant electrodes in a very small number of people, plant electrodes in their brain, and give them electrical activity in certain areas of the brain that helps depression in some of those people. This is not a normal treatment for depression, but it's interesting that scientists know enough about the brain to know where to put an electrode in order to help people with depression. What are some of the treatments that are typically used for depression? Well, number one, it's very, very common, of course, for people to be given prescriptions for medicines that are called antidepressant medicines. And for unipolar depression, we have the SSRI drugs, which are the most commonly prescribed. They are drugs like Prozac and Zoloft and Paxil and Celexa. And then there are the SNRI drugs. Okay, what's the difference? SSRI drugs, they are serotonin reuptake inhibitors. NRI drugs, norepinephrine and serotonin reuptake inhibitors. These are drugs that influence the brain chemistry in order to increase the activity of certain brain chemicals, certain neurotransmitters. In the old days, the TCIs were used, tricyclic drugs. They're not used so much anymore for treating depression. And then the MAO inhibitors, these are drugs that inhibit the recycling of monoamines, certain brain chemicals, and that makes those brain chemicals more common in the brain. All of these drugs are relatively safe, although there are some dangers, especially you have to be careful with teenagers, for example. Now, if you have bipolar disorder, we have mood stabilizers like lithium, which are extremely efficient at treating, well, not exactly treating, but helping people control or manage their symptoms. It's not a cure, but it keeps people from having severe mood swings, works on about 80% of people with bipolar disorder. Also, sometimes anti-seizure drugs are used and other drugs. Quite often, people take a sort of a mixture of drugs to treat their symptoms. Now, if you don't like medicines, we have CB therapy, cognitive behavior therapy, which is a talk therapy in which a person learns how to control their thoughts, their behaviors, and their emotions. And studies have shown that CB therapy is just as effective for treating depression as medicines are, although probably works on different people. So in the future, maybe we'll have some way to test people. In fact, we do that today, is test people to determine the dosage of a drug that they need. But in the future, perhaps we'll be able to tell with a genetic test which patients will react better to medication and which react better to talk treatments like CB therapy. Fourth, one of the most effective treatments for depression is exercise, although we have to warn people because just like with medicines, about 10% of people actually get worse from medicines or from exercise instead of better. So people are different, of course, and have different brain chemistry and different experiences and different causes for their depression. So any one particular treatment isn't going to work on everybody, but exercise, physical exercise, has been shown to be very good. A lot of doctors are now using meditation or what is called mindfulness, in which you concentrate your mind on your thoughts and your behaviors. A lot of doctors are now using this in a treatment of depression. And when depression is really extreme, We have ECT, electroconvulsive therapy, which the public calls shock treatment, which is very effective, but unfortunately, you have to do this in a clinic or a hospital setting, and a person has to be anesthetized, which can be dangerous, and electricity is applied to the brain to cause a seizure. So this is not a minor treatment, it's a rather severe treatment, but it can be effective. And then number 7, magnesium. Turns out that a lot of people have magnesium deficiency, and this can lead to depression. It's pretty darn common for people to not get enough. We usually get magnesium from our food, but the soil has been depleted of magnesium, so the plants just don't have much in it. So sometimes a magnesium supplement can help. Number 8, a treatment that, well, it's not very common, but it's gaining in popularity, is called TMS, or repetitive TMS. TMS stands for transcranial magnetic stimulation. Transcranial means across the head. So what this means is that a magnet is placed near the head, and a very powerful magnetic energy stimulates brain cells, and this sometimes helps people with depression. Another new treatment that is not very often used, maybe rather extreme, but some scientists are looking into this. There's a chemical called ketamine, which is an anesthetic often used in treating animals. It's also used as a recreational drug, sometimes called Special K. But in small doses, it produces a rapid antidepressant response. Within hours, people can be relieved of depression. So it's very effective in treatment-resistant patients, but not a common treatment yet. A variation of ketamine called S-ketamine has been approved now for use in treatment-resistant depression, people who resist other treatments. And there's a brand name called Spravato, which is now being used as a nasal spray to help people whose depression does not respond to other treatments. Okay, that'll do it for this video on mood disorders. My name is Bruce Hinrichs. I'm a psychology professor, and my channel is called Brucey. Please watch some more of my videos, and thank you for watching this one. I hope you learned a lot. Bye.